G'day everyone, Dr. Claire Hudson here. Before we dive in, I need to tell you something that might surprise you. I've spent over 25 years treating blokes in their 60 seconds, 70 seconds, and beyond. And there's one problem that comes up more than any other. Most men are too embarrassed to talk about it, even with their mates down at the pub. But here's the thing that most blokes never hear about. And honestly, it's changed lives in my practice. What if I told you that the same white powder you use to clean your kitchen sink or freshen up your fridge could help restore blood flow where you need it most? I'm talking about baking soda, sodium bicarbonate. Now, I know what you're thinking. Claire, you've lost the plot. But stick with me here, because what I'm about to share with you is backed by over 2 decades of clinical experience and some pretty solid science. Before we get into the nitty-gritty, I want to know where you're watching from. Drop a comment below and let me know. Are you watching from Sydney, Melbourne, Brisbane, or maybe somewhere regional? I love hearing from you blokes, and it helps me understand who I'm talking to. Right. Let's get fair dinkum about this. If you've ever wondered why things don't work quite like they used to, you're not alone. It's not just in your head, and it's definitely not something you need to accept as inevitable. I've seen too many good men resign themselves to a life without intimacy, thinking that's just what happens when you hit 60. But that's absolute rubbish. Let me paint you a picture. A few months back, a patient came into my clinic. We'll call him Harold. He's 68, retired tradie from the western suburbs, been married to his wife Margaret for 42 years. Harold came in looking pretty defeated. He told me, "Doc, I feel like I'm letting Marg down. My mind's willing, but my body's not cooperating. I've tried those little blue pills, but they're bloody expensive, and they give me shocking headaches." Sound familiar? Harold's story is the same story I hear week in, week out, and here's what I told him. The same thing I'm telling you today. Your body is an incredible machine, but like any machine, it needs the right fuel and the right conditions to run properly. As we age, a few things happen that affect performance down below. First, your blood vessels become less flexible. Second, your body's pH balance can shift more acidic. Third, circulation isn't what it used to be. And fourth, inflammation starts creeping into places it shouldn't be. Now, this is where it gets interesting. Sodium bicarbonate, plain old bicarb soda, addresses every single one of these issues, and I'm going to explain exactly how, with the precise dosages and instructions that so many of you have been asking for in the comments. Because I've seen your questions, and I hear you. You want specifics, not just theory. Let me break down the 10 benefits that I've observed in my practice over the years. These aren't just theoretical possibilities. They're real results I've documented with real patients. Benefit number 1 is improved blood flow. When your body becomes too acidic, your blood vessels constrict. It's like trying to water your garden with a kinked hose. Bicarb helps neutralize that acidity, allowing your blood vessels to relax and expand. More blood flow means better, stronger erections. It's that simple. Benefit number 2, and this one's crucial, is better oxygen delivery. See, your red blood cells carry oxygen using a protein called hemoglobin. When your blood pH is optimal, hemoglobin releases oxygen more efficiently to your tissues, including the erectile tissue. Bicarb doesn't just reduce acidity, it actually optimizes how your hemoglobin delivers oxygen throughout your body. More oxygen to the tissue means better function. Benefit number 3 is reduced inflammation. Chronic inflammation is like rust in your engine. It slows everything down and damages tissue over time. Bicarb has natural anti-inflammatory properties. I've had patients tell me they notice less joint pain, better digestion, and yes, improved sexual function, all from addressing inflammation. Benefit 4, improved energy levels. When your body is constantly fighting acidity, it's exhausting. You feel sluggish, tired, unmotivated. Once you balance your pH, that energy comes flooding back. Several of my patients have reported feeling like they've got their mojo back, not just in the bedroom, but in life generally. Benefit 5 is better kidney function. Your kidneys work overtime to maintain pH balance. By supporting them with bicarb, you're taking pressure off these vital organs. Healthy kidneys mean better overall circulation and toxin removal, which directly impacts erectile function. Benefit 6. Enhanced nitric oxide production. This is the real game changer. Folks, nitric oxide is what causes blood vessels to dilate. Those expensive medications you might be taking, they work by affecting nitric oxide pathways. Bicarb supports your body's natural production of nitric oxide, without the side effects or the hefty price tag. Benefit 7 is improved prostate health. Many blokes over 60 are dealing with enlarged prostates, and that can definitely affect sexual function. The alkalizing effect of bicarb can help reduce inflammation in the prostate area, leading to better urinary flow and improved erectile function. Benefit 8. Better hormonal balance. When your body is in a chronic state of acidity, it affects your endocrine system. This includes testosterone production. By optimizing your pH, you're creating an environment where your hormones can function properly. Benefit 9 is improved confidence. Look, I know this might sound soft, but hear me out. When you know you've got a natural solution that's working, when you feel better physically, that mental confidence translates directly into performance. It's a positive feedback loop. And benefit 10, this one's often overlooked, is better overall cardiovascular health. What's good for your heart is good for your erections. They're both about blood flow, after all. The cardiovascular benefits of bicarb extend well beyond just sexual function. You're supporting your entire circulatory system. Now, here's where I'm going to give you the exact information you've been asking for in the comments. I've seen so many questions about dosage and timing, so let's get specific. Here's my recommended protocol, and this is what I give to my patients. Start your morning with 1 glass of lukewarm water, about 250 milliliters. Add a 1/4 teaspoon of sodium bicarbonate, that's about 1-2 grams. Squeeze in half a fresh lemon. Stir it well, and drink it slowly, on an empty stomach. First thing in the morning. Why first thing? Because your stomach is empty. The bicarb can be absorbed more effectively. Why lukewarm water? Because it's gentler on your digestive system and helps with absorption. Why lemon? The lemon provides vitamin C and helps activate the alkalizing effect once metabolized. Now, some of you have asked, Claire, how long until I see results? Based on my clinical observations, most blokes start noticing changes within 2 to 4 weeks. Some notice improvements sooner, particularly in energy levels. For erectile function specifically, give it a solid month of consistent use. How long should you continue? This isn't a quick fix and then you're done. Think of it as a lifestyle change. I recommend 3 months initially to see the full benefits, then you can adjust based on how you feel. Some of my patients continue indefinitely because they feel so much better overall. Here's what happened with Harold, the patient I mentioned earlier. I introduced him to this morning routine with bicarb, lukewarm water, and lemon. I also suggested he cut back on processed foods, increase his water intake throughout the day, and take a 20-minute walk each morning after breakfast. Harold came back to see me 6 weeks later. The change was remarkable. He told me, "Doc, I feel like I'm 50 again. Margaret and I are like newlyweds. The headaches are gone, I've saved a fortune on those pills, and I've got energy to spare." His blood pressure had improved, his prostate symptoms had decreased, and yes, his erectile function was significantly better. But here's the critical part, and I need you to pay attention to this. Bicarb isn't suitable for everyone, and there are some important warnings I need to share. Do not use this protocol if you have kidney disease or reduced kidney function. Your kidneys need to be working properly to handle the sodium load. If you're on a sodium-restricted diet for heart conditions or high blood pressure, talk to your GP first. The sodium content in bicarb can affect these conditions. If you're taking medication, particularly for blood pressure, diabetes, or heart conditions, you need to consult your doctor before starting. Bicarb can interact with certain medications and affect how they're absorbed. Don't exceed the recommended dose. More is not better. Taking too much bicarb can lead to alkalosis, which is just as problematic as being too acidic. Stick to the quarter teaspoon I recommended. If you experience any stomach upset, bloating, or discomfort, reduce the dose or stop and see your doctor. Some people are more sensitive than others, and this should go without saying. But bicarb is not a replacement for medical treatment. If you have serious erectile dysfunction, diabetes, cardiovascular disease, or other health conditions, you need proper medical care. Bicarb can be complementary, but it's not a cure-all. Now, I've been reading through your comments, and there are a few questions that keep coming up. So let me address them directly. Someone asked, can I use this with other supplements like garlic or ginger? Absolutely. In fact, raw garlic is fantastic for circulation. One of my patients swears by his morning routine of bicarb water followed by a clove of raw garlic with olive oil. Ginger is also excellent for circulation and inflammation. These can all work together beautifully. Another common question: what if I've already tried bicarb with lemon and didn't notice a change? This is a good question. First, make sure you're using the right amount. A quarter teaspoon. Not more, not less. Second, give it more time. Some blokes need 6 to 8 weeks to see significant changes. Third, look at your overall lifestyle. If you're drinking heavily, smoking, eating rubbish food, and not moving your body, bicarb alone won't perform miracles. It's part of a bigger picture. Someone asked about combining this with exercise. Brilliant question. Exercise, particularly resistance training and walking, is absolutely essential for maintaining erectile function as you age. The combination of bicarb for internal optimization and exercise for circulation and testosterone is powerful. I've also seen questions about whether you should use bicarb topically. Look, I've heard all sorts of creative applications, but I'm going to stick with what I know works from clinical experience. The internal use, drinking it, is what I recommend. The benefits come from systemic pH balancing and improved circulation throughout your body. Here's something else I want you to understand. You're not broken. You're not past it. Your body is capable of remarkable things when given the right support. I've seen men in their 70 seconds and 80 seconds regain function they thought was gone forever. Age is just one factor, and it's not the determining factor. The difference between the blokes who see improvement and those who don't usually comes down to consistency and lifestyle. You can't drink bicarb water every morning and then smash a six-pack every night, eat takeaway constantly, and never move your body. Your body is a system, and everything is connected. Think of your circulatory system like the plumbing in your house. If you've got good water pressure, clean pipes, and everything flowing smoothly, all your taps work properly. But if the pipes are clogged, the pressure is low, and there's rust in the system, you're going to have problems. Bicarb is like a pipe cleaner for your circulatory system. I also want to address something that came up in the comments. Some of you are dealing with diabetes, and you're wondering if this is safe for you. Diabetes and erectile dysfunction often go hand in hand because high blood sugar damages blood vessels over time. If you're diabetic, you absolutely need to work with your doctor on this. The bicarb protocol can be helpful, but your blood sugar management is priority number one. Get that sorted first, and everything else becomes easier. For those of you asking about prostate issues, I hear you. An enlarged prostate can definitely impact sexual function, both directly and indirectly. The good news is that the anti-inflammatory properties of bicarb can help with prostate inflammation. But again, if you're having serious urinary symptoms, you need to see a urologist. Don't try to self-treat serious medical conditions. One more thing I want to mention because it came up several times in the comments. Some of you are feeling pretty down about this whole situation. You're feeling like you're letting your partner down, like you're not the man you used to be. I want you to hear this clearly. Your worth as a man, as a partner, as a human being, has nothing to do with your erectile function. Nothing. That said, I understand that sexual intimacy is important. It's part of a healthy relationship, and it matters to you. That's why I'm sharing this information. But please don't let this issue define you or destroy your self-esteem. You're dealing with a common physiological challenge that has solutions. Right. Let me bring this all together for you. If you take nothing else away from this video, remember these key points. 1. Start with a quarter teaspoon of bicarb in lukewarm water with lemon juice every morning on an empty stomach. 2. Be consistent. This takes time to work, typically 2 to 4 weeks minimum. Ideally, give it 3 months. 3. Support it with lifestyle changes. Drink plenty of water throughout the day. Get regular exercise. Reduce alcohol. Quit smoking if you haven't already. And eat real food. 4. Check with your doctor if you have kidney issues, heart conditions, high blood pressure, or if you're on medications. 5. Don't exceed the recommended dose. More is not better. And 6. Be patient with yourself. Your body wants to work properly. You just need to give it the right conditions. I've spent over 25 years helping blokes just like you reclaim their vitality and confidence. I've seen this protocol work time and time again, but it's not magic. It's science combined with consistency and a holistic approach to health. Your health matters. Your vitality matters. And you deserve to feel strong, confident, and capable at any age. This simple morning routine with bicarb could be the game changer you've been looking for. It's affordable, it's accessible, and for many blokes, it works. If you found this information helpful, do me a favor and hit that subscribe button. I've got more videos coming about natural approaches to men's health, including specific foods that boost circulation, exercises for better erectile function, and how to optimize your hormones naturally as you age. Drop a comment below and let me know if you're going to give this a try. I want to hear from you in a month about how you're going. And if you've got questions, ask them. I read every comment, and your questions help me create content that actually answers what you need to know. Remember, you're not alone in this. Thousands of blokes are dealing with the same issues, and there are solutions. Stay strong, stay curious, and I'll see you in the next video. Cheers, folks.